Hello, my name is Jeff Hostetter. I'm a physician and Director of Geriatrics Education at the UND Center for Family Medicine Residency in Bismarck, North Dakota. I would like to talk to you today about some healthcare disparities and chronic diseases that are prevalent among American Indian and Alaska Native populations. Some of this will possibly be a surprise to some of you, but probably not. What I think the takeaway message here is going to be is that we have made very little inroads in addressing some of these healthcare disparities. By the end of this module, I hope that you understand and know what the difference in life expectancy of indigenous populations is compared to non-Hispanic white population in the United States. I'd like you to be able to list 3 chronic diseases that lead to increased mortality in indigenous populations as well. In 1974, the average life expectancy of indigenous person in the United States was approximately 64 years. We made some progress over that time. As you can see, in 2024, the life expectancy was 73 years. However, the general U.S. population is 5.5%, or excuse me, 5.5 years longer than indigenous populations. Infant mortality is significantly higher as well, almost twice as much, at 7.6 infants dying per 1,000 deliveries. And maternal deaths are almost 5 times as high in the indigenous population at 118.7 per 1,000 people. Alcoholism, homicides, suicides are all higher than the white population. Here were the statistics in 2008. So not quite 20 years ago. You can see that the hazard ratio on the right of the items that are highlighted in yellow are ones that are more than 1.5 times as prevalent in indigenous populations as in the dominant culture population. The ones that stand out, and that won't surprise you very much, are diabetes, which is 2.8 times higher rate of diabetes in indigenous people. Homicides were 1.8 times higher, and suicides and motor vehicle accidents also were quite a bit higher. Interestingly, there's less chance of getting Alzheimer's disease if you're an indigenous person. Cancer risk is about the same. These are the most updated data that are available at the Indian Health Service website. Most of them are unchanged. Diabetes is higher than it was in 2008. Chronic liver disease, suicide, accidental injuries, all of these are essentially unchanged. So, in spite of our best efforts, we've not been able to make inroads into these causes of death among American Indian and Alaska Native people. Other disparities that you might not think of, or that you can think of as causes that lead to these differences in disease burden, would be differences in funding for health care that is available to indigenous populations. The Indian Health Service in 2019 spent approximately $4,100 per patient that they cared for. In the U.S. general population 2 years before that, in 2017, was $9,726 per capita. So over twice as much that we spend in the dominant culture for healthcare. And while someone argue that money isn't the most important thing, it certainly is likely a factor when we're talking about care for advanced diseases and expensive medications for things like diabetes. The complexity of access to healthcare is important. It's very difficult, with many more hoops to jump through to access care through the Indian Health Service than it is through private insurance or Medicaid, Medicare. There's inadequate patient education, which has its roots in mostly cultural and historic events and causes. There's disproportionate poverty among American Indian people, and which is true for all people of color. And there's discrimination in the delivery of health services once they do access the care outside the Indian Health Service. I see this every day in my hospital in Bismarck, and this is not isolated. These are some resources that you can access to look up these statistics as well as find others. But this is a good introduction to the ones that are most prevalent and are being addressed most aggressively by the Indian Health Service and tribal health leaders across the country as they try to improve the health of Indigenous people. Thank you. Hope this has been informative.